of how chiropractic became what chiropractic is today, because the art of adjusting the spine, adjusting bones, is really older than chiropractic itself. In fact, we go back 2,500 years, and Hippocrates wrote, "When in sickness, look to the spine first." They knew something in that era, and even predating that, the Egyptians in their hieroglyphs talk about some type of adjusting, and bone setting we find actually existed on every continent, in every society. There was some form of dealing with the body and making energy flow. Some of it looked pretty terrifying too in some of those countries. You've seen the video of the guy taking the hammer with the chisel. Those are usually wood mallets with wood chisels that they'll work on the spine with. Our term chiropractic came about in 1895. D. Palmer was a magnetism healer, which was laying on hands, and he discovered when he'd adjust certain areas on the spine, he could get specific effects. So chiropractic was actually done by hand, that's what chiropractic means, but it was taking the areas that are adjusted and looking for specific effects they might have on the body. And he opened many of the original schools. His son, B.J. Palmer, continued that work and really made chiropractic a household name. B.J. was a very charismatic, in-your-face type of individual, and so we can thank him for chiropractic surviving the onslaught of attack that chiropractic survived through the 30s through the 60s in the United States. And as I say, this was done by hand. We started to develop different tables, so we didn't have to take and pull the coffee table and the nightstand out to do adjustments on people as the art of adjusting was perfected. And there's some pretty interesting tools that got invented too for adjusting. This thing called the grasshopper was, yes, what you're thinking is true. He would place that little stylus onto the bone he wanted to, and then take his hand and hit that handle there. This isn't really used anymore. Lots of funny electronic instruments were also invented through the years for adjusting. Coinciding with the development of chiropractic, 1895 is when chiropractic got termed a science. X-ray also came about, and X-ray was also invented in 1895, and the two were very synonymous together. The original growth of chiropractic and X-ray were closely linked, because this is the way they used to do X-rays. They would have that gamma ray tube just going off in the room, and the doctor would be looking through a phosphorus-coated piece of glass. He'd get actual three-dimensional and live person view, so the person could actually move around. Some very interesting contraptions were devised so the doctor could see that motion in the body or different positions in the body. And this was real life now. This was 3D, this was with motion, so that it was very valuable to see how the box spine was moving. Unfortunately, it was also quite lethal, and all the doctors that did this ended up with cancer in their hands at minimum, and patients were getting really high doses. So that when they discovered the dangers of radiation, it changed the profession quite a bit. So today, an X-ray is a snapshot in time. It's a two-dimensional. You don't get that 3D, and you don't get the movement unless you go in and do video fluoroscopy, which is, once again, expensive. And so now, when this picture was taken, we can maybe get some information for adjusting on it, but when it's older, you don't need to be adjusting what it looked like 6 months ago or a year ago. You can take a picture of your house and the paint looks really good, but 10 years later the paint needs to be repaired. So they needed to find another way of dealing with the spine, and so static palpation, motion palpation became very popular. So that's feeling for the high spots, or feeling what doesn't move right in the spine itself. And while it makes sense, this is logical, this is like, okay, this sounds like this would work really well. In research, it actually doesn't come out that well, because you can take 10 doctors, have them assess the patient, and you get 10 different opinions on where the sticky uppy spot is and what's not moving right. So it doesn't stand up well to research. So we needed to develop a way. What's another way that we can get into that spine, find out what's wrong with it, without inducing all the radiation dosage? And so in Activator, we use a neurologic technique that's looking for a leg length change. It's a reflex that occurs in the body. And this is actually the original isolation test that Activator came up with. And it involves bringing that hand up above the head. Now that's checking for a segment that's down here. It's that 12th thoracic vertebra. It's the vertebra that separates the thoracic spine from the lumbar spine. And Dr. Furr, the developer of the activator technique, he was on the table, had his associate doctor look at his legs to see if the leg length was changing, and he's explaining to him how when he reaches across that table and pulls that little lever for the foot plate on the type table that he had, he feels this pain in his back. Well, they knew this was an area that frequently needed to be adjusted, but as he's explaining it, the associate doctor is watching as he brings the arm up. He sees the leg length change. He says, bring your arm back down. Now they're even. Bring your arm back up. So, and why would that happen? It has to deal with the musculature. And in fact, you can test this out yourself. You can take your thumb and find the iliac crest here, the little bone on your back, and kind of feel those muscles. Now, if they're not too tight, you'll feel when you go to lift your arm, you'll feel that muscle in your low back actually contract before you even lift your arm. So that's what we're looking at. We're looking at stabilization patterns in activator technique to work our way through that spine, stair step our way up and find out where's the neurologic problem. Now, we can couple that with finding the high spot. We can feel it and see where's the sticky uppy spot. But now we know which sticky uppy spots are pissing me off. So that's more valuable. Now, of course, we got challenged on this whole idea of the leg length. So, the doctor's inducing it. So we did another study. We took and hooked up this camera equipment and little lights onto the feet themselves, little fiber optic lights. Now, today this could probably be done with an iPhone, but back in the 90s when this study was done, you had to buy expensive equipment to do it. And what we found is a test for the fifth cervical element is if you lift your head and look up, that's isolating that specific spinal segment. And if there's no problem, the legs just contract. You stabilize that motion, but both sides contract symmetrically. If there is a problem with C5, though, you see how you have a difference. One leg contracts more than the other, so there's that asymmetry showing up. We know there's a problem. Now, the cool thing is we can come up and provide the adjustment to that region, and then it goes back to being even. We know immediately if we affected the nervous system. And as I always tell my patients, the trick is, can I get you out in the street doing your normal day-to-day activities? So if we take an intact mechanoreceptor, it sends a normal signal to the neuromuscular control unit, you get a normal response, and that coordinates motion. You have no problem with that if that's happening in your body. If there's something interfering with that signal, it corrupts the signal, the feedback's wrong, you get a corrupted response, and now you don't have correct coordination, and that adds adverse consequences happen. We get higher stresses on the ligaments, the mechanoreceptors themselves, you're getting the wrong signals, muscles fatigue, you get higher facet loads, and that's a recipe for chronic pain. Instruments we use in our adjustment are the activator instruments. I brought those to my 3-minute to show you how the progression of this instrument has been. It's been a spring-loaded instrument until most recently, 2012, the electronic instrument, the Activator 5, came out. We started with getting 40% activation of those nerves. We now get 94% activation of those nerves. And yes, we've got a lot of research to back that up, 157 peer-reviewed papers over the last 25 years. So if this is interesting to you, come do a one-to-one with me or come into my office and talk to me. Dr. Zane Gard with Walker Road Chiropractic.